If you're a veteran in Long Beach or caring for one, and you've ever wondered whether that VA can help pay for home care so your loved one can stay safely at home, you're in the right place. Today, we're going to break down real VA home care benefits, who qualifies, and how this works right here in our community. Welcome. My goal today is to clear up, hopefully, confusion and give you a step-by-step understanding at a very high level of VA home care benefits, specifically for veterans living in Long Beach and Los Angeles County. Veterans have earned many benefits through their service, and some of these benefits can directly help with in-home support services, but the system is complex. I'm not going to say it's perfect navigating it, it's confusing, and many families don't know where to start, what's covered, or what to expect. By the end of this video, you'll understand what VA home care programs actually exist, how eligibility works at a very high level, what services are covered, how Long Beach veterans can access these benefits, and how family caregivers can be supported too as well. So let's start with the basics. To access most VA home care benefits, a veteran generally needs to be enrolled in VA healthcare, have a clinical need for support with activities of daily living. So usually it's a VA primary care doctor for the vet that's doing that assessment of clinical need. Number 3, meet specific eligibility criteria for the program you're applying for. So if someone, again, is not yet enrolled in VA healthcare, you can apply directly. That's the very first step, directly at Long Beach VA Medical Center by walking in. You can also apply via phone, online, as well as by mail. So enrollment is the first step. You always want to do that first before you can access most home care benefits. Next also is you also have to have some eligibility around active duty service of at least 90 days with at least one during wartime. And absolutely must have honorable discharge are common requirements for pension-based home care benefits. Now, the VA offers several programs that bring support to a veteran's home, each serving a slightly different role. The VA Homemaker program, or the Homemaker and Home Health Aid Service program, this is the core VA home care benefit that provides training aids to assist veterans with everyday tasks like bathing, grooming, dressing, meal prep, light housekeeping, feeding, and mobility assistance. This benefit helps veterans stay in their homes rather than moving to a facility. And a veteran's local VA team assesses the needs and determines how home care visits are necessary, how many hours are approved per week. And quite frankly, this is where almost all home care agencies deliver their services, is through this program. For veterans with complex medical conditions who find it hard to travel to appointments, the VA offers home-based primary care. This brings medical professionals, including nurses and social workers, into the home for ongoing care and monitoring. Now, the next program is the respite care program. The respite care gives family caregivers a temporary break. This can be a few hours at home or through adult day programs. It helps prevent burnout and gives caregivers time to rest, attend to their personal appointments, as well as manage their personal responsibilities. These services, all these programs, are part of the VA's broader home and community-based services designed to support veterans where they live. Now, many veterans think that the VA only pays directly for home care services provided by VA programs. But veterans can also access other financial benefits that help cover private home care costs, including with local agencies or local private home care agencies. One of them is the aided attendance pension. This is one of the most powerful tools for paying for home care. It's in addition to a veteran's standard pension that provides extra monthly money income if the veteran needs help with daily living activities, is bedridden or housebound, meaning they can't leave the house, or has limited eyesight. This benefit can be used to pay for in-home care services, whether from a family member or a professional agency, such as Right at Home Long Beach. Now, amounts received change yearly, But for 2026, aid and attendance can provide significant monthly support, up to several $1,000s, depending on the veteran's status, income, and care needs. Now, this benefit can be combined with other VA care programs, as I mentioned prior, or can use on its own to help, quite frankly, hire private home care services or an agency. Now, the next program I want to talk about is the Housebound pension. For veterans who are permanently confined to their homes because of disability, the VA offers a housebound pension supplement. This can also help offset home care costs. Now, these pension programs are especially useful in Long Beach and in Los Angeles County, quite frankly, where cost of living, as we all know, cost of living and caregiving expenses can be very high. Now, the next set of programs I want to talk about is support for family caregivers. The VA recognizes the crucial role that family caregivers play, especially in the home care setting. Now, the next program I'm going to talk about is called the Program of Comprehensive Assistance for Family Caregivers. This program provides a monthly stipend for eligible caregivers, training and education, mental health counseling, travel assistance when accompanying a veteran for VA care, and health benefits due to CHAPA if the caregiver isn't already covered. So that's a type of insurance for caregivers. Now, to qualify, veterans typically need a high disability rating for this program, generally 70% or higher, and caregivers must meet a certain criteria. Now, this support helps families provide consistent, high-quality care at home without burning out. And it's available right here in the Long Beach area. Now, I want to move on to, again, delving a little bit deeper around how to access these benefits, because that's very important here in Long Beach. So it involves a few key steps. As I mentioned earlier, number one step is enrolling yourself in the VA healthcare program system. If you're not already enrolled, you can apply in person at Long Beach VA Medical Center, online, by mail, or by phone. You can still keep your other programs or insurance like the HMO or Medicare. That's fine. Number two, you want to get assessed for clinical needs and ask about these programs. Say, I want to be assessed for the Homemaker program, as an example. Your VA clinician will evaluate you or the veteran need for home care services and supportive care. Number three, you want to coordinate with a VA caregiver support coordinator who may help you navigate what these services and benefits apply from various situations. Number four, you want to apply for a pension and aid and attendance. This, of course, all these programs require different forms, submitting VA forms and documentation. You may also want to engage county veteran service officers or VSOs to help guide the process. I know there are 3 on site here at Long Beach VA Medical Center, and they're free to you for access. And then lastly, you want to communicate clearly with your care team. Many of these benefits these programs may or may not be brought up by your, let's say, your VA caseworker or social worker or primary care physician. But you want to advocate for yourself and say, hey, I want to be assessed for these programs based on my needs in the home. That's really important. Now, of course, these programs don't cover everything, just like anything else. It offers a lot of support, but they don't cover everything. Non-medical transportation to appointments is typically not covered through home care benefit programs. Assistance on holidays or outside of approved hours may be limited depending on the program and the provider network in your area. Some services like elaborate housekeeping or errands may not also fall under VA programs and may need to be covered through your pension benefits. So just understanding some of your limitations, again, going more in depth, talking with your VA social worker and understanding what are the limitations so that you can avoid any surprises you may have. Now, here are some practical tips to help you get the most out of your VA home care benefits if you're here in Long Beach or in Los Angeles County. Number one, start early with eligibility enrollment and enrollment. Don't wait until a crisis. It takes weeks, if not months, for processing as well as getting appointments. Keep all your discharge paperwork, your DD-214, your medical records, your service documents, income documentation. Reach out to your local Long Beach VA caregiver support coordinator. They're here to help you navigate specific options. Consider working for county, as I mentioned, county VSO, veteran service officer, so they can assist with pension applications. And of course, ask about telehealth and home-based primary care if travel is difficult for you or getting out of the house. Veterans in Long Beach have real valuable home care resources through the VA, but accessing them, as you can imagine, takes knowledge, patience, and advocacy for yourself. Whether you're exploring the Homemaker, home health aid services, aid and attendance, caregiver support stipends, or home-based primary care, there is support available, but you just need to understand the process, and it takes time. Lastly, if this helped you, please, as always, like, subscribe, and share. And subscribe to this channel. If you need direct assistance navigating benefits in Long Beach, don't hesitate to reach out to your local VA office or a trusted veteran service organization, or even my agency here in Long Beach called Right at Home Long Beach. You earn these benefits, so let's make sure you get them.